Okay guys, our first question is which of the following electrolyte changes is not considered a complication of Tumour Lysis syndrome? The options are hyperuricemia, hypokalemia, hyperkalemia, hypocalcemia, and hyperphosphatemia. The correct answer would be B, hypokalemia. This is because with this syndrome you have a lot of cell breakdown, and with this cell breakdown you're going to have high levels of potassium, uric acid, and phosphate in the body. Then that phosphate and calcium are going to bind together, causing secondary hypocalcemia, and the calcium phosphate is then going to deposit throughout the body, which is why hypokalemia would be correct. Our second question is premature ventricular contractions are extra contractions, or known as extra beats of the heart, that are not initiated by the SA node. Which of the following medications are most likely to be ordered in the treatment of PVC? Please select all that apply. So the correct answer would be beta blockers, lidocaine, and amiodarone. So we would administer beta blockers because this will slow down and help control the heart rate, but it will not reverse the arrhythmia. Lidocaine would be correct because it decreases the irritability of the myocardium, and this will reduce the number of preventricular contractions. And amiodarone would be correct as well, because amiodarone suppresses the preventricular contractions, again reducing the amount. Norepinephrine would be incorrect because it would stimulate. It can actually trigger more preventricular contractions if we were to administer this, as well as digoxin. This can also trigger preventricular contractions, and it can also change the sodium and potassium balance in the body. And our last question is a patient is diagnosed with Tumour Lysis syndrome. Which order would the nurse expect to receive? Again, please select all that apply. So the correct order would be A, calcium gluconate, C, assessment of the bowels, and D, allopurinol. We would want to give calcium gluconate because, as discussed already in class, this is a protective agent against the heart, and we'd want to give it first to make sure that heart's being protected. We would want to do an assessment of the bowels, and this is because we want to check for constipation, as it's a potential complication of sodium polyestyrene. And we would also give allopurinol 500 milligrams BID, and this is because, again, discussed earlier in our electrolyte question, we have high uric acid levels, so this allopurinol is going to help decrease that. And it's also going to help prevent further acute kidney injuries as well. We wouldn't want to give potassium chloride because, again, in our other question, we said we had high potassium levels, so this will just make it worse. And E would be incorrect, fluid restriction, because we would want to be giving them an IV fluid of 150 mL an hour to prevent further kidney injury as well.